exercise daily. Even more so when you had a stroke and you're trying to recuperate mobility, motor control.
Yeah, you're gonna have a 70% chance of recovery, but the patient doesn't like that because they want to hear, I'm gonna have 100% recovery.
Yeah, you want to be objective, but at the same time, you got to toe that line because you're playing with someone's hopes and dreams.
Yeah, so you want to give them some hope.
Yeah, if you want me to guide you through this and hold your hand, I'm gonna try to make it as safe as possible, and I'll help you.
I was going over there to help stand her up. She was gaining more strength.
Yeah, I remember that.
And that work was meaningful to me because I was like, damn, I think I can get her to stand up.
Discarding an idea is also an action.
Yeah.
Because if not, just ruminating in your head, taking up space. So this is scary for me. Like, I don't know. This is a big risk, but you're just doing it anyway, and that's cool.
What do you envision your clinic running like? When you think of your clinic, what do you see?
Bro, like a lot. Like you're partially paralyzed, you have spasticity, you know, your mobility is compromised.
Yeah, let's talk about, think about the gentleman who's painting right there at the office. He had a stroke about 6 months ago.
Mm-hmm.
He has hemiplegia, right? He has half of his body which is kind of contracted. He's walking with a limp. He's trying to still work in construction.
I wouldn't say, he probably does have some hemiplegia, which is like weakness in the limbs. But he has good movement, but it's not as fine as what he probably used to have.
Yeah.
So there's he's battling some tone, which is like an increased tone in his muscles, which is why he looks like, you know, it's kind of stuck when he walks. But his mobility is decent, like he's able to work.
Yeah.
You know? He's able to work, which is not necessarily common after a stroke. But he's still gonna have like severe fatigue. Like your brain has to work so much harder on one side, you know, from the side from the opposite side of the injury. Like it works a lot harder. There's a lot more energy involved, a lot more energy expenditure involved. So he probably experiences like a really high level of fatigue, which can result in like disorientation. Maybe that's why he doesn't see the pain.
Yeah. But even that, by the end of the day, or I'm sorry, like think about it. He's coming onto the job site, and there's other construction workers there, and here comes a guy who's limping with one of his arms sort of contractured. So already there's gonna be like judgment towards him. Can this guy pull his own weight?
Yeah.
Is this the worker we should have on the site, et cetera, et cetera?
That's what external people are thinking.
Exactly.
But what he probably feels the weight of that tenfold.
Yeah.
He probably feels judged, or maybe not. Maybe I think he uses it as fuel. Remember, he talked to us about like, oh, the doctor said this and this, and I was like, I'm gonna show him that I can recover, you know.
Yeah,
so sometimes, you know, they switch that, and he could use it as fuel and motivation, but that's not always the case. And I'm sure that there's things that he could work out in therapy for sure, like accepting certain things, processing things, like you said, the way that it impacts his daily life, and how he can, you know, make that work with it instead of against him.
So what do you bring to a patient like that as a neuro PT, as somebody who's specializing in post-stroke, post-traumatic brain injury, whatever the case is, like the different types of patients that you work with? What do you bring to the table to really help these people?
I think first, after initial injury, like after initial, you know, a stroke or TBI, there's so much that people don't know about that that's the fear. Like the part that brings you the most fear is the unknown. Mm-hmm. You don't know anything about neurological injuries. You don't know anything about stroke. You don't know about TBI. What's your life gonna look like? So I think at the beginning is a lot of education, a lot of, hey, this is what this can look like. This is what rehab looks like. This is what, return to work looks like. This is what your prognosis looks like. A lot of education, a lot of encouragement, a lot of reinforcement, and providing resources. Anything that the client wants to know, or the client's family, or the patient wants to know, or the patient's family, like, you address those unknowns, because just having a little bit more information on things that you don't know about brings you some peace. And granted, it could take a long time for them to get there, because they're still going through the grieving process of losing their ability to walk or go to the bathroom, or their independence, bro. That's hard. That's super, super hard. So while neurological rehab takes a long time, because you have to do countless repetitions to have that neuroplasticity take place, and it has to be intense. And sometimes you can't even get that intense initially, because they're not well conditioned. They're still recovering. So
how long does that? Let's say your typical. Obviously every case is different. Somebody like him that we're talking about, he has a stroke. You see his level of functioning where he is. He has a limp. He has some deficits in his arm as well. How long do you think it will take for him to rehab if he's and at least gain 70 and 80% of where he was before?
I think he's already there.
Yeah.
I think he's already regained 70 to 80% of where he, he's back to work.
Yeah.
He's walking around independently. He's carrying things. He's painting. He's whatever. He's
doing drywall. He's plastering.
Yeah,
he's drilling.
Crazy stuff.
He's getting up on a ladder.
Yeah. So he's recovered a lot, but it just depends on the severity of the injury. But already, just in healthy individuals, the recommendation for exercise is forever, right?
Yeah.
Exercise daily, even more so when you had a stroke and you're trying to recuperate, mobility, motor control, balance. Like, it's tenfold, bro. Like, you have to continue. I think the rehabilitative process doesn't really, end.
Gotcha. What about just the spasticity that he has, like the contractures? Will that be able to relax or extend a little bit, or is he always going to have somewhat of that deficit?
I think it could improve for sure. He doesn't have he's not contracted. He has a little bit of tone, but he can break out of it and move voluntarily.
Okay. So
that's different. In some cases you can't move out of that spasticity at all. So then it can become a contracture over time because you're in the same position, but initially it's just tone. Like, your muscles are just involuntarily contracted. They're contracting. They're like, and you can break out of it and you can stretch them.
Yeah, and you can open it up, but it goes right back. It up,
but it'll go back.
Yeah.
So the interventions for that are largely like Botox works, some mild toxin, so it can help reduce the spasticity. But even sometimes, man, it's so strong. Even the Botox doesn't necessarily work.
Would you consider yourself an optimist when it comes to your work with your patients, in terms of you're always trying to look at the positive side and you're solution focused?
Of course, man. Like, I think you have to be in anything that you do.
How important is that for the mindset of the patient to have a clinician that is just positive in nature and solution focused?
I think a lot of patients have that, initially. You get injured, you're like, all right, you have a lot of optimism and hope because that's what you want to get. And then sometimes, a healthcare provider will come along the way and be real with them. But they're real with them to a certain extent because data exists to a certain point, right? There's a certain point in someone's recovery where you stop studying. You don't follow them as much anymore, or they're not having consistent rehab. So there's always, I think, a gray area, or like a place that we don't necessarily know where recovery happens, that you just don't know unless you go there. Whether that's, extending the recovery period for a long time, or the intensity, data only covers so many things. And that's what healthcare providers are communicating, data, rightfully so, right? Because that's where we can be certain.
Yeah.
I can confidently tell you this.
Yeah, you're going to have a 70% chance of recovery, but the patient doesn't like that because they want to hear, I'm going to have 100% recovery.
Yeah.
But the statistics show that that's not likely, and you're just being completely objective with them.
Yeah. Yeah, you want to be objective, But at the same time, you got to toe that line because you're playing with someone's hopes and dreams.
Yeah, so you want to give them some hope.
Yeah, I'm not saying I don't think you're playing with them, but you're talking about it, you know. Yeah. So like, it's you got to toe that line. I think it's hard because physicians, you know, they see it every day, and you get desensitized. So
what do you say to the patient who says I can't? Like you're trying to work them through an exercise, and they run into that wall. I can't do it. Well, like, what's your response typically to that?
Well, I say keep trying. You know, let's keep trying. But I can't force them.
Yeah.
You know, like I'm there. I tell them I'm here. Like I'm willing to try. Let's do it. If you want to, like I'm ready to go. So you know, it's got to come from them still. I can't force anyone to do anything. And if there's no patient buy-in, you know, as well as anyone, that the outcomes are lower.
Of course.
So.
What do you say to the patient who's trying to do something that you think is beyond their limits?
I don't stop them, man.
You let them make that attempt.
I say, let's get it.
All right.
If I think it's beyond their limits, I'm gonna be cautious, you know. I'm gonna make sure it's safe. Like I'm gonna try to cover my ass, you know, and cover the patient. Like make sure that they're not putting themselves at risk, like health wise. But at the end of the day, it's their life, man. If you want me to guide you through this and hold your hand, I'm going to try to make it as safe as possible, and I'll help you. But, bro, people put their lives at risk all the time. You pick up a box of cigarettes or a bottle of alcohol or whatever, pills.
Yeah.
So if you're going to put your life at risk to gain something, you know, positive for yourself, I'm not going to stop you.
I see you working a lot with amputees. I guess, how inspirational is that work to you to see somebody who's overcoming the loss of a limb? Because when I watch it from the outside, I'm just like, oh, this looks badass. Like you're really helping. It feels like you're really doing PT that I don't see a lot of people doing. It's really separating yourself from the crowd. And I'm not dismissing what other physical therapists do, but I'm just saying like this is something that definitely stands out.
Man, I gotta be honest. With those guys, a lot of it comes from them. You know, I'm there as a guide, you know, I can put together a treatment plan, but the work is being done by them. Like, you know, most of the time I'm hands off. I'm just teaching, guiding, motivating, pushing, putting together a plan, following what the evidence is, you know. If you do so and so, your outcomes might be this. And I communicate that, and then they do the work. So for me, I get inspired too, you know. So it's like I'm just there focusing on them, their recovery, like getting them whatever they need at that time. You know, obviously I have my objective like viewpoint where I'm like, okay, this can improve, let's work on this is how I'm going to tackle this. But they're doing the work. So it's super inspiring, you know. It's like I don't know why, but I feel like, man, I have so many positive experiences that if I ever do get injured in any way, like I have those things to fall back on, which I'm grateful for, because a lot of people don't, you know. You might get injured and you don't know what it looks like for you or for anyone.
Yeah, you don't know what the progression looks like. You don't know what that surgery looks like, the outcomes of the surgery, etc. That happened to me. When I tore my pec tendon, I originally thought, oh my God, this is the worst surgery. Like, what does this surgery look like? I'm imagining. And once I had surgery, I was like, oh, this wasn't that bad. I should have done this a long time ago.
Yeah.
But I didn't have the education. The surgeon that I saw just told me, oh, it's inoperable. Just let it be.
You don't know.
Yeah.
Like, I'm currently working with two amputees, and both of them, like neither of them had met, like, you know, they had met, but one of them hadn't met another amputee, let alone with the same amputation, or, you know, it was a little bit different the way it happened, but they were similar age groups, you know, like middle age, and they were young, fit guys. So like when they met, it was like you could see how uplifting it was for one of them, you know. The other one had already experienced that, so he knew too. But just being, you know, in the same room as someone who has gone through it, you know, or has experienced something similar to you, can just bring you a lot. It can bring you a lot. So I don't know. It's fun for me to be around people that are pushing themselves daily, you know. So that's the meaningful part of my job.
That's cool. I want to transition into entrepreneurship. I know that right now you're stepping into the unknown of running your own show and
crazy.
Getting a little space right here at AMP headquarters.
Super excited.
What has that transition been like for you in terms of just all the little steps that you've taken already up to this point? How many steps do you think you've taken up to this point?
Daily?
Yeah, exactly.
Daily.
How long ago did you start? Well, how long ago did you start the process of deciding, I want to go into entrepreneurship, and what has that looked like since then?
I mean, probably like, there's always an idea in your head.
Yeah, but no, action. When did that
Action
start?
steps probably started this year, like in February, when you got the building, when you got the space, and you just put it out there. You should take one of these spaces. And I was like, I don't know. I just started connecting. I was like, man, maybe it could work.
Yeah.
And I just felt ready. I don't know. From all the conversations that I've had throughout the years with several other entrepreneurs, physical therapists, physicians, and yourself, bro.
Mm-hmm.
We're close. We're friends,
Yeah.
and I see you on the grind daily. One of my clients is an entrepreneur, and I don't know. I just got bit by the bug. So I started taking those actions, like, all right, and you made it simple, bro. It's like, I remember that conversation where you're like, don't look at it, in a bird's eye view, because when you look at it at a bird's eye view, there's a lot.
Yeah.
There's a lot, and it could be intimidating, man. Like, damn, how am I gonna do all of this, or where am I gonna get this lump sum of money? And you're just like, let's tackle it one thing at a time, And I was like, all right, let me scratch all this and just focus on.
So up to today, what are the steps you've taken so far? I know you've chosen a space. How many calls did you make to insurance companies, malpractice insurance, EHR?
Man, I've had a lot of conversations with ChatGPT.
Yeah.
Tons, man. Just running numbers, like asking for business models, seeing which worked for me, which route I wanted to take. And obviously I've had some experiences working with other clinicians too, like in other clinics, seeing their business model, seeing my company's business model, and just kind of cross-referencing everything to see which one I wanted to go with or which one worked for me. So that's just that process alone takes a lot. You're sitting here or you're in your house and you've got something on Netflix and you're not watching it. You're just like, you're just doing something.
Yeah.
You're just thinking, and then it's like you pick up the phone and you chat GPT and then you write it down, like, okay, and then you discuss that with someone else who's doing it. So that process alone, and I think that's like just thinking about it, is a big part of it. Dedicating time to it and then writing it down. And then you start executing, you start asking questions, you meet with people who have done it before.
That part never ends. Everything you're saying right now doesn't end. Because look, I'm looking at this piece of paper here, it's a bunch of stuff to do, and it's the same thing over and over. It's like, an idea comes to your mind, you write it down, you work through it, you talk to somebody else about it, you bounce that idea, you come back to it, you draw it up again.
Make a decision, and then you take an action course, or discard it. Yeah, but that, discarding an idea is also an action piece. Because if not, it just ruminates in your head, taking up space. So it's like, you got to make a decision on an idea, whether or not you're going to execute it. So
what made you finally decide, I need to take action, I want to do this?
Bro, watching you. Yeah, watching you take action, like telling me like, this is scary for me, like, I don't know, this is a big risk, but you're just doing it anyway. And that's cool. It's like, okay, you have the feelings, like, this is a big risk. I'm feeling them now.
Yeah.
I feel the risky feelings, like, oh shit, this is like, damn, this might go bad or whatever. This might go any different way, but you just do it anyway, and you see how it goes. So I do that a lot at work. You come up with an idea, an intervention for a client. It's like, could work, could not work. Let's do it.
Let's do it. Let's figure it out.
Let's do it and see what happens. Because you're making decisions that are based on data, but then you have anecdote, you have an individual patient, all those things you have to consider. And the same thing with entrepreneurship. It's like, okay, I have the objective data, I have numbers, I have, reimbursement rates, I have, you can crunch all the numbers, but then you have your anecdote, the people you talk to, what's worked for different people, the business models that they're doing, and then you have your own individual experience and your circumstances. So I take the model that you have, that I apply at work, and I'm applying it here. It's weird.
Why is it weird?
I just never thought of it like that. Like that just came up right now in my head. Like, yeah, it's cool. You have your data. Yeah, you have your data. You have your
intervention.
Your anecdote, which you get from different people, and then you have your own individual experience, your circumstances, what's around you, and that's the same thing for healthcare.
What do you envision your clinic running like? Like, when you think of your clinic, what do you see?
I want it to be a place where people want to go, people want to be, people want to stay, people feel inspired to be there, and people put in work. You know, some place that they go and they feel welcome, and they feel like you know, when you go into a gym and you work hard and you feel good about it. That's what I want my clinic to be. Obviously, for a greater, it's meaningful for someone who's had a neurological injury or any injury at all, you know, to work towards recovery. So I want that to be a space where, you know, anything's possible.
Why'd you get into PT to begin with? Why physical therapy?
I got into PT as like a trainer. I was teaching CrossFit. People asking me a ton of questions. And I didn't know the answers about movement, about why they felt certain things, and I had no idea how to answer them. And I would ask other seasoned trainers, and their answers were similar. You know, stretch this or stretch. The answer is always stretch. You gotta stretch it out. And I was like, there's got to be something more than this. And I started shadowing a PT, and I was like, okay, this guy knows a lot. His knowledge is different than just standard trainers or whatever. And then I started seeing other types of physical therapists, neuro PTs, pediatric PTs, you know, geriatric PTs, and I'm like, wow, you know, this is a broad spectrum. I want to learn this craft. Mm-hmm. Then I went after it.
And how'd you fall into neuro PT specifically?
I like neuro PT because it's challenging. I think it forces you to be creative in a lot of different ways.
But how did you fall into it? Like, what made you choose that?
I had a professor at school who was like, hey, you know what?
Who's a professor?
His name's Miguel Garcia.
Okay.
Yeah, he still teaches there. He teaches the neuro. He's the head neuro. And he was kind of just like...
Where does he teach? I'm sorry.
The University of St. Augustine in Miami.
Okay.
Yeah, and he was kind of just like, hey guys, you know, don't be scared of neuro, you know. Don't be surprised if you become a neuro PT, and everybody's like, nah, because a lot of PTs want to work with ortho and sports and all that, and yeah, I don't know, I was open to it, and he showed a lot, and he's one of those guys that's like, I'm a neuro, I don't do backs and I don't do you know, ankles or whatever, but over the course of my student career, like while I was studying, I met a lot of PTs that did both, you know. But you blend them. It's the same musculoskeletal system. You know, everyone has nerves, muscles, bones, ligaments. So they're affected in different ways. Yeah, you bring in the brain, which I think is a little bit intimidating for people. But again, it forces you to be creative, to think a little bit harder, and you know, it's tough sometimes. I think people stay away from that because when you have someone with a neurological injury, they're dealing with a lot.
I just remembered something you posted the other day. You had a woman or a man, I don't remember, going up the stairs and then pouring a cup into a water bottle. What was that about?
All right, so let's break down the intervention. Right, yeah. So I had her in a single limb stance. So she's standing on one leg.
With the other one on the next step.
Yeah. So she's offloaded, right?
Okay.
She's offloading the left leg, and the right leg is the one that she has some difficulty with. So now she has to focus on balance. I had her loaded with a weight vest, so her weight bearing is increased on the leg. and she has some motor control deficits on her right hand, especially fine motor control. So at a distance, when things are further away from you, you have to
really work harder.
You have to be a little, and to be more accurate in motion. So, but it's a dual task thing, right? So she's balancing now and focusing on the water while working the hand. It's a lot of different things. But it just looks like she's pouring water, you know?
No, but I know it was difficult for somebody. I'm thinking about somebody with a TBI and how difficult that is, depending on how their motor control is. So
yeah, she's post-stroke. Post-stroke. So yeah, so she has some fine motor control deficits, but you know she's got good voluntary motion, and then she has some strength and balance deficits on her right leg. So
the work that you're doing has
everything.
The work that you're doing has a lot of meaning to me specifically. My grandmother had a stroke in 2025. I think it was 2017. December of 2017 she had a stroke. My grandmother used to always make lenteja when she wanted to have everybody come over the house. And so it just so happens that she was making a lenteja, and that means she's rounding up the troops, you know? She's rounding up the family for something. Not everybody doesn't go and sit down at once, but she was little by little, she was making it, and then she would just start calling people, oye, hice lenteja. And you know that she would just let you take a bowl, you have that bowl, and I said, no, that's it, you're gone. That's all you get.
That's it, yeah.
But then the conversation starts there. So she's making lenteja, and apparently she goes down, she has a stroke. My mom calls her, she must have been down for like 7 hours, bro. Yeah. 7 hours.
That happens a lot.
Yeah. So my mom, when she gets in the house, she finds her, she's out on the floor. And I mean, me, all I thought was, yeah, that's it. Like, DNR, do not resuscitate. Let's just let Abuela pass. She's been down for way too long. She's not coming back. And I don't know if you guys have ever seen the Terry Schiavo case or anything like that, but I didn't want my grandmother to just be in a vegetative state and be bedbound and fed through a G-tube and having a mechanical vent to keep her alive. But my mom just believed in her faith and believed in just her ability to heal. And she didn't get out of bed. My grandma never got out of bed. From then on, she was always contractured. Her speech was very limited. Shit, need some therapy for this, but she lived the rest of her life where she still had joy and love and like excitement. But I know there was a part of me that right before COVID hit, I was going over there to help stand her up. She was gaining more strength.
Yeah, I remember that.
And that work was meaningful to me because I was like, damn, I think I can get her to stand up again. I think I can get her to have a little bit more strength in her arms. And I just remember thinking, damn, how many people have been through this, and at least if they had somebody there every day to help them, like this shit could make a big difference in their life. Because the outcome, I was seeing the outcome in real time. COVID hit, and then that's it. My mom was like,
don't go over there.
You come over here, your grandmother dies, it's gonna be your fault. So I just was like, yo, I put my arms up. Yeah, I put my arms up, and I was like, I didn't get to physically see my grandmother for almost a year until finally I just said, well, I didn't even tell my mom. I just knocked on the door. I was like, I need to see my grandmother.
Yeah, it's hard.
But so that's where I could see like this work has deeper meaning than people realize, because you just think, oh, a stroke. We just say it so loosely, right? But when you see your loved one that you've known your whole life, all of a sudden they don't talk anymore. Half of their body is either contractured or just immobile. Then it's like, how do I help this person, right? What do I do to help this person get better? And so I think that the work you're doing is so powerful. Like I think that little space is gonna change lives, and I can't wait to see it. I can't wait to watch it.
Thanks, man. I'm super excited for that. To have my own space to do that, because you're right. It is the meaningful part of it. It's why I chose Neuro, because it's like such a, you can feel so helpless in that situation, in that moment. Like a lot of families do, they don't know.
Yeah. I mean, I wish I had somebody to just train my mom to help. What could she do to help, you know?
Yeah.
Even if it was just the most simple things.
Yeah, and it's hard for families too, because, you know, that they might not feel confident, or they might not want to hurt, their family member, or, do something.
Not my grandmother was still swinging with her left. She would pop my mom with her one now and then.
Exactly, man. So it's different for everyone.
Yeah.
Every situation is different, and sometimes you have families that need more help than others, and sometimes it's a big person or something, and they can't really necessarily move them.
That's true. People who are like
big,
obese,
just a big guy. You can
stroke.
just have a big guy. Man, I've done some crazy shit. I've gait trained some dudes that were like 250. Can't. One leg is like.
Explain gait training, because people probably won't know what that is. What is gait training?
It's walk training, pretty much, but the way you walk train someone, it just looks like you're walking, but I have to break down how they're walking and what they need in order to walk successfully. And that depends on what deficits they're having, whether it's hemiparesis or weakness, or maybe it's sensory deficits, maybe it's tone, hypertonicity, maybe they need a brace, maybe maybe it's at the ankle, maybe it's at the knee, maybe it's at the hip joint, maybe it's balance. Maybe they're like, legs are fine, but their head is spinning. Very common after stroke or concussion or TBI.
No, they're just having
a lot of dizziness, and it's disorienting. You can't imagine being drunk and walking drunk, but you're not drunk. You're just,
the room is just spinning around you
at all times. So you have some pharmacological management. You have you find whether it's like visual, whether it's vestibular, in the brain, or if it's peripheral. There's a lot. Balance wise, maybe you just lost sensation in your feet and you don't have any ankle support. So balance is like a very complex system too. So when I'm gait training somebody, I have to evaluate it, evaluate the whole body, evaluate the patient, see what their perception is, if they can talk, If they can talk, that's great. Sometimes they can't talk. Sometimes I'm just like, you try your best to communicate, but you can't. So, and then you have your assistive devices, you have your walkers, you have this, you have that.
Describe the gait trainer, because that was one piece of it. I know you've been in the process of purchasing equipment, right, to prepare the space.
Yeah.
What is the gait trainer? Because you kept on saying that was so important for your line of work.
It's a body weight. It's a body weight support. So it's a harness. You strap, the patient in there, and you can use it for different ways. So it's like a stand that has a hydraulic component, and I can lift them. So if they need help standing, or if they're not strong enough to support their own body weight, I can lift them and provide some of that support. Now, it's similar to what you can do with a walker, right? Like, I give you a walker and you can support your body weight, but you're doing it with your arms.
Yeah.
So
they're supporting. Where does it support them? From the waist?
It's
from
like,
the hips?
from the body, pelvic, abdominal region. It's like from the chest down to the hips.
So it's like a girdle almost?
Like a girdle, yeah.
Yeah.
And then I put them on there, and it depends, if I want to work just stepping pattern, I can do that over a treadmill, I can do that over ground, I can push the speed, I can do a lot of different things because my hands are free and I don't have to worry about catching them if they fall.
Because they're not going to fall because they're harnessed in.
Yeah, and you have to toe that line. If you're not challenging them enough to where they can make errors, the brain's just not going to learn. So it's going to keep that safe pattern. If you never take away that walker,
that's it. That's going to be it.
Yeah.
You're going to depend on the walker forever.
Yeah. That's not true for like musculoskeletal injuries,
of course,
right? Eventually you'll be able to walk without a walker.
But for neurological
injuries, yeah, for sure. I think you have to toe that line.
So with the girdle, do you determine the percentage of body weight that the harness is helping them with, or how does that work?
That's the machine. There's
okay.
It'll take their weight, and it'll tell me, I'm off weighting a certain percentage.
Okay. Yeah, no, I'm curious to see once that machine is in there, because I want to see how it works. I want to try it on.
It's a lot of fun. Yeah, for sure.
Yeah.
I'll lift you up.
Like just lift in the air, hanging.
Just lift you up. Yeah.
That's
yeah. So you can off weight as much as I need, and And that's my determination, you know, like, okay, this is how much weight this limb can support. Because, you know, when you walk, you're standing on one leg for the majority of the time. So that's part of the evaluation process. And then I have to, and then it's not just walking in a straight line, you know. Sometimes you got to walk when you're looking around, or you're moving your head, and you're changing your eyes, or you got something in your hands. That's called dual tasking, or you're walking backwards, or you're changing directions, or you're turning. There's a lot of pieces to gait training, for sure. And that gait trainer helps me because it frees my hands and it makes things very safe.
Yeah, so you can hand them something while they're walking so that they can reach.
I can do whatever with my hands. I can provide assistance as needed. You know, I can do anything. With my hands are free, and I don't have to stop them from falling.
So what are the next steps for you to get going?
Well, we gotta get this building finished.
That's one thing. That's my responsibility.
You know, besides all that legal stuff, the permitting stuff, and I gotta set everything up, lay the floor.
Any other equipment that you need besides floor mats?
Yeah, tons. You know, little foam pads. Got these things called blaze pods. They light up. You know, and
I've seen the blaze
kind
pods.
of reaction things. You know,
I've seen them use it with fighters just for reaction time.
Yeah, for reaction time. So I can do that. You know, in front of the treadmill. So it's a dual task while they're walking. Or I could do it in single limb balance, you know, working on balance while they're working on different things. Yeah. So I can use those a lot. I got those. I got, you know, some small little dumbbells. Because, you know, I could treat shoulders. I could treat backs. I could treat everything. I'm going to be more neuro-based for sure. But, hey, if you got some shoulder problems and you know how I work, you want to work with me,
let's go.
Come through. I got your shoulder.
Awesome, man. Where can people find you? Your Instagram, website.
My Instagram is Dr. Klaus Blandon. Yeah.
Dr. Klaus Blandon. We'll put it in the bottom.
Yeah. Sorry, I'm not as good at this as you, brother. It's Dr. Klaus Blandon. Yeah, that's the Instagram. The website is going to be www.gaitwaypt.com, and that's GAIT way.com. Yeah, pt.com. So be on the lookout. We're gonna start blasting it soon. We're right on Coral Way at 24th.
Let's go.
Yep, let's get it.
Awesome. I know I'm excited, Klaus.
That's gonna be dope.
I'm excited to see what this looks like. Honestly, 3 months from now, 3 months, 6 months, 9 months, 12 months down the road.
There's not a lot of neuro PTs, so we're gonna do some special stuff, some fun stuff. I pushed the envelope.
I'm excited to be along for the ride, man.
Yeah, me too, man. Thank you, bro.
No, thank you.